From the News Channel 5 Network, this is OpenLine.
Well, good evening and welcome to Open Line. I'm Chuck Long. As always, great to be along with you. Tonight it is time for Ask the Expert. And our guest today is going to be somebody I know you're going to be wanting calling, Dr. Nicole Rudowski. We're going to ask the optometrist tonight. And as always, the number is there on your screen. You can call us at any time throughout the next hour. 737-7587-737+. And we'd love to hear from you with your questions, with your comments. Dr. Rudowski, great to see you again.
Good to be here.
Now, I know this is a busy time of year with school starting back up, and I know you're seeing a lot of patients. Is it always like that with school rolling around?
Oh, yes, absolutely. It's our busiest time of the year, that's for sure.
Which brings me to the question of, when do you think people should start going to the optometrist, the eye doctor?
Sure. Usually what I recommend to do is at least by the time the kids start school, definitely get their eyes checked then. Unless you know there's a big history of nearsightedness or lazy eye in the family, I'll check them as young as 3 at my office. If there's any concerns younger than that, usually then I'll send them over to Vandy to have their eyes checked. But yeah, usually at 5 and then yearly after that, absolutely.
And so basically on a yearly rotation, so
Yes.
just start at 5. Are there things when people first bring their children to you that they seem particularly concerned about, or is it just getting them into that routine?
Most of the time when parents bring their kids in, it's because they're sitting too close to the TV, they're squinting a lot. The teachers have had to move them to the front of the classroom because they can't see the board. Those are usually the big concerns. That or if both parents wear glasses, they're usually pretty good about bringing them in. Sometimes I've had several lately that they'll go and take the permit test and they fail the vision portion there. So hopefully most of our kids don't get to that age before they know they need glasses, but that's very common for my teenagers. So definitely if your kids have not had their eyes checked before you take them to get their permit or their driver's license, make sure they come on in, because you don't want to wait for an hour or 2 in line and the first thing to do is check their vision, and if you don't pass that, then you don't get to take the rest of the test.
All right, that makes sense. Now, I know there's always a lot of comments and questions when we have you on the show. You're one of the popular guests that we have about cataracts. But one of the questions that I often get, because people see us doing the show together, is that someone says, well, I always hear about cataracts, but basically, what is a cataract?
Sure, that's a big question every time somebody comes to my office, they ask. There's actually a structure inside our eye called the lens. It's right behind the iris, or the colored part of the eye. Up until our 30s and our 40s, that structure is very clear, and the light can pass straight through to the back of the eye. Somewhere in our 30s into our 40s, just from UV light damage is the most common cause, it'll start to yellow. And as it yellows, the light can't get through to the back of the eye like it used to, and then you start getting blurred vision. Most of my patients tell me they start noticing a lot more halos at night when they start noticing it. Sometimes just things almost looks like you're looking through like a dirty window, is what a lot of my patients will tell me as well. So usually people are a little bit older before they actually develop cataracts. Usually, most of my patients are closer to in their 70s or 80s when they get them. I've sent some people out as young as in their 20s for cataract surgery if they've had trauma to the eye, if you're diabetic, if you had to take steroids for any reason. You can develop a specific type of cataract a lot earlier, but just getting it checked, just if you have a family history of it, you're more at risk for it. Biggest thing you could do is wear sunglasses. Even try to get your kids. I have 2 kids, they're 2 and 4, and it's tough to keep the sunglasses on them, but the younger you start them, the better they'll be with wearing sunglasses. A lot of the damage is done actually as a kid. Usually as adults we're a lot better about wearing those sunglasses, but if you can get the kids wearing them a lot younger, it'll help in the future for them as well.
Now, one of the things too, of course, we love the fact on Open Line, this is your forum. This is your chance to give us a call if you have a question, if you have a comment. Anything, put it on the table and we will do our best to answer it. And I know a lot of times people often feel like, well, I don't know how cataract develops, you know,
Sure.
and what do I do to prevent that? Is there a way to prevent it, and how does it develop?
Yeah, like so the biggest thing to do to prevent it is to wear those sunglasses, especially too if you are more at high risk. Like I said, if you have things like arthritis or you've had to take steroids for a long period of time, or if you're like me and get a lot of sinus infections and have to use steroids, just anything that puts you more at risk, diabetics, just make sure you get them checked yearly. Most of my patients, we catch them pretty early on, but I'll have some people come into the office and they just waited a long time to get their eyes checked, and they'll be 2,200 in their eye before they ever come in for an eye exam. So you don't ever want it to get to that point. Usually if you're 20, 40 or worse, the surgeons can go ahead and do the surgery with insurance paying for it. The biggest things, again, preventative, are wearing those sunglasses, some type of eye protection. A lot of my patients that are out, the farmers are really big about developing them really young. Especially living in the South, we have a lot more UV rays here, and so we get them a lot younger age if you don't wear those sunglasses. That really helps out tremendously.
Now, you bring me to a point, a lot of times with your eyes, people say, well, is that a myth? Is it fact or is it fiction? So throughout the evening tonight, wanted to go over a few of these, and if there are questions that you may have regarding fact or fiction with your eye health, go ahead, call us with those at 737-7587. But let's just start at the top. Eating carrots will improve your vision, fact or fiction?
It will keep your eyes healthy, that's for sure. It won't actually improve your prescriptions. If you're real nearsighted, eating carrots won't make you not have to wear glasses anymore, but it'll definitely keep your retinas healthy. There's a certain beta carotene in it that will help to keep your macula very healthy, and that's that spot in the eye where you get that 20/20 vision. So it does help prevent things like macular degeneration. So it's very healthy for your eyes, but it's not going to make it so you don't have to wear glasses anymore.
Okay, makes sense. Good to know. Right now we're going to the lines. Online with us this evening, Leslie is there. Leslie, good evening. Thanks for calling in. Do you have a question or a comment for Dr. Rudowski?
I have a question.
Okay. And what is the question?
Yes, I have an impairment to my right eye. They say I have a scratch over my pupil, and I was trying to see, do she know anything that out there available to correct that?
And you said you had what about your pupil?
Scratch on his pupil?
Yes.
Sure. Okay, usually with the pupil, since it's inside the eye, usually you don't get too much of a scratch there unless you've had tremendous trauma. Usually it's the cornea, the front surface of the eye. The best thing with that is to be able to use some kind of lubricating drops before you can get in. Usually we try to give you some antibiotics to try to clear it up if you've had it for just pretty recently. If you've had it for a long time and there's a little bit of a scar there, you could try go to an ophthalmologist and see, but usually unless it's really severe and it's been there for a long time, they really don't usually have any surgery they can do. We can try to give you eye drops, though, to help clear it up.
Okay. Well, Leslie, thank you so much for calling in this evening. Have a great one. All right. Goodbye. Okay. Now, when we were talking before Leslie called in, some of the fact and fiction questions, wanted to go ahead with a couple of these.
Okay.
Sitting too close to the TV will damage your vision. We hear this a lot of times.
Yeah.
Okay. So let's first address the TV.
Okay, very good. That is fiction. A lot of our patients will do it. Kids are notorious for getting way too close to the TV, and a lot of it's just because they want to get a little closer to it. But it's not going to make you more nearsighted just by getting really close to the TV. So I have my parents all the time tell me, will you please tell my kid if they keep getting that close to the TV that their eyes are going to get worse? And that's definitely a fiction on that one.
Okay, good to know. Now, I said let's start with the television, because now we all sit in front of computers much of the time, or our tablets. What about that? Can you sit in front of your computer for too long?
It definitely can cause a lot of eye strain if you're in there too long. I usually tell my patients if they don't need reading glasses at that point, just maybe take a break every 15 to 20 minutes, even if you just look up and look at the clock across the room, just to kind of give your eyes a little bit of a break. A lot of my patients are usually somewhere, if they're farsighted, usually somewhere in their 30s, coming in needing reading glasses now. We just use a lot more of the computers and tablets than we used to. So people I see going in a little bit younger just because we're just using our lenses a lot more in our eyes. So definitely, it's not going to make your eyes worse by using them, but it's definitely going to cause some eye strain if you don't take some breaks.
Okay, one more, and then we'll go back to the phone lines. And this is something that I was telling you before we went on the air that my dad has often talked to me about, but reading in the dark will weaken your eyesight if you don't have enough light.
Also, and they're very common when I hear from my parents, they're saying, can you please tell them to put the lights on when they read in bed at night? It is not going to hurt your eyes to do that. Again, it can cause a little bit more eye strain, but it's not going to make you develop more of a prescription by reading. It's going to make it a little easier on your eyes, but your vision won't get worse just by doing that.
Okay, so I'm just going to make sure that this is taped and my dad can see that back in Dallas. And Dad, I can read in the dark. It's okay. All right, we're going back to the lines right now. So on the line with us, and I'm sorry, Andrew, who do we have? Gina, how are you this evening, Gina?
I'm great. How are you?
Doing excellent. So do you have a question or a comment for Dr. Rudowski?
It's not a question. I just told them I got a juicer and I started juicing carrots, and the carrots have improved my eyesight a lot because I went to the eye doctor. I got new glasses, and my eyesight was not as bad as it was 10 years ago. And I'll be 64 in October. So I don't know.
That could have something to do with it. Carrots, I mean, obviously they keep them really healthy. So a lot of times my patients, too, that are nearsighted, it's a normal trend for you to become less nearsighted, more farsighted over time. So I have a lot of my patients that are nearsighted that when they come in, each year I tell them their vision's getting better and better. As kids, it doesn't do that. But usually as adults, my nearsighted patients get better. But I say, hey, if your vision's getting better, keep doing what you're doing. Like I said, it definitely will keep them healthy.
Yeah, because I just started doing carrot juice, and all of a sudden they're better.
That's great.
Well, that is good to hear. So thank you so much for calling in, and have a great evening.
And thank you. You all have a wonderful day.
We appreciate it. All right. Okay, so we are with Dr. Nicole Rudowski. If you're just tuning in, we are talking about your eyesight. Optometrist, and I know this is a busy time of year. You're talking about going back to school and people getting in there to get those checkups and that sort of thing. We talked about children coming in and they do a yearly examination. What's your recommendation for teens and then into adulthood?
You know, for us, we like to see everybody every year just to keep an eye, make sure everything's healthy. A lot of my patients don't come in because they don't think they need glasses. We have a lot of our patients that come in that actually do need glasses and don't realize they do. But even if you don't need glasses, just to make sure your eyes are staying healthy, especially if you have a family history. So we just recommend yearly because there's a lot of things if we can pick up on it early, then we can prevent you from losing your vision. A lot of things you don't even have any symptoms to until it's extreme and already so far gone you've already had damage to your eye. So we just definitely recommend yearly eye exams.
All right, great to know. We are going to take a short break, but if you have any questions, comments, I know a lot of times we talk about cataracts, we talk about macular degeneration, so many things so important to know about your eyes. And if you have a question, this is your forum, 737-7587. We'll take a short break and more right after this.